what happens. Oh, there we go. Hi, everyone. Welcome back. Today, we're joined again by Dr. Eddie Stenehjem. We're going to be discussing what's been going on for the last week in the state of Utah and around the country, specific to our case counts, a couple of different places that have opened up a little bit more, and some studies that have been released. Eddie, thanks again for joining us. We really appreciate your time.
Absolutely. Happy Friday.
Happy Friday. So our case counts that were released from yesterday, the state hasn't updated their data quite yet for today, but as of yesterday, the case counts were at 8,921 cases, 731 or 34 hospitalizations, and 106 deaths. We also had our highest single day case count on Wednesday, reported with 215 cases. So we've seen a pretty significant increase over the last month since the state opened back up on May 1st. What are some of your thoughts on that? What do you think is going on, and why do you think this is happening?
Yeah, you're right. So if you're looking at the daily case counts on the Utah Department of Health website, what you'll notice is the counts are going up, and they're going up slowly, but they definitely aren't decreasing. And I would say they're not really plateaued. They're definitively going up. And yesterday we had 211, I believe.
Okay.
Cases reported. That was from Wednesday. That's our highest number of case counts per day. The second highest was back in the first part of April, 203. And so that's pretty significant that we're seeing those numbers of case counts in conjunction when we look at our hospital census data. And so we're looking at how many people are in our hospitals with COVID-19. So these are severe COVID-19 pneumonia patients. Those numbers also are, trending up. They're relatively stable, but, on average, we have between 70 and 80 patients in our hospitals at any one point in time. And so those are numbers that, make us pretty nervous. The why behind it. We opened back up, really starting around May 1st. And then we had Mother's Day a couple weeks later, where it was very clear that people were out and about. Mill Creek Canyon was packed. People were, out. And now with Memorial Day just having passed with more people out, I think what we're seeing is just the result of less social distancing and more people moving about in our communities. And that's being reflected in our case counts. Right now, we're not seeing exponential growth. We're not seeing that kind of growth that's really going up. We're just seeing a steady increase, which allows us to remain, and have capacity within our hospitals.
Yeah, I keep hearing from people too that it's summer and they want to enjoy it because they think that there's this potential that we go back into more of an isolation in the fall. So I think a lot of people's mentality too is, I need to enjoy the next 2 months as much as I can because I might get COVID, I might not, but I'll probably not be able to leave my house again, which is unfortunate. And it's not the way that you avoid that spike either.
No, and the worry is that we're going to have to potentially go back in isolation earlier.
Right.
And we don't get to the fall. And so, that is a concern that we have to deal with, and we have to reevaluate as we go in terms of capacity, testing capacity, our PPE capacity. All of those things go into those decision making, both at an Intermountain level and also at a state level in terms of assessment of risk. And now is the time for us to be really, really cautious.
Yeah, you can still enjoy hanging out with friends and being outside, but just considering all of those aspects of we can't just switch this flip to go back to the way we were a couple months ago or last summer even.
No, not at all.
Yeah, it's not going to work.
Mm-hmm.
Another thing too that I wanted to talk to you about was we had a team of caregivers that went to New York at the beginning of April, and they've been back in Utah for about a month. And I know that you've been talking a lot with that team that deals with COVID cases and how they were doing. And we're happy to report that none of them contracted COVID-19 when they were in New York. All of them are healthy. Do you want to talk a little bit about why you think that's the case, even though they were sent to this epicenter of COVID-19?
Yeah, these 100 caregivers were amazing. They, the sacrifice they made to go and help out New York in their greatest time of need. And we're talking about respiratory therapists, ICU physicians, hospital-based physicians, nurses. These are people that were front and center in New York City in managing hundreds of COVID-19 patients. And so they did just an incredible amount of work, and what they did was really appreciated by the New York City. We wanted to make sure that as they came back, that they were safe, that we could really evaluate them and make sure that they didn't get infected with COVID-19 while they were in New York. And so when they came back, we did nasal swabs on day 0 and day 7 from when they came back. So we did 2 swabs looking for active virus in their nose 7 days apart. And, very reassuringly, none of them had any detectable virus when they came back. In addition, we did serology tests right when they got back, then 14 days later. And we didn't see anybody convert from a serologic standpoint as well. And so we're pretty confident that none of them contracted SARS-CoV-2 while working in New York City. And I think that's a testament to our personal protective equipment. Like, these people were in the heart of the beast, and they came back safe. And we don't have any evidence that they were infected at all, and that they could safely reintegrate into our healthcare system and take care of our patients again. And we were very relieved at that, that they remain safe and that they all remain healthy.
I think it's important to know too, we didn't ask them to quarantine afterwards if they weren't showing any symptoms. They went back to work. And like you said, it's a testament to the fact that they had proper PPE in New York and they had proper PPE here, and that masking and creating a barrier between yourself and these patients actually works, which I think is really important.
And, the thought behind them going back to work is that we were comfortable with our PPE here within Intermountain too. And so even if they were asymptomatically infected, when we take care of patients in our hospitals, we're all wearing masks, we're all wearing eye shields, and we practice good hand hygiene. And so we felt comfortable with that. And we just had, reassurance that they're all negative by our studies as well.
Yeah, and we're actually going to be speaking to another one of those nurses next week to talk about their experience. We've been going through a couple different people to talk about how they felt in New York and what their experience was. So that will be really interesting. Last week during our Facebook Live, we got another question, which we didn't get a chance to answer, about if someone tests positive for COVID-19, they go home, they quarantine, and their family members get sick around them. Are those people being tested for COVID-19 as well? And what happens? Do they count towards those case counts for Utah as well?
Yeah. So if somebody gets diagnosed with COVID-19, whether they go to the hospital or not, the state health department does contact tracing of that positive case. And so they'll go and they'll interview the patient that's positive, and they'll determine who they've been exposed to in the previous 7 days and who is the highest risk for contracting COVID-19 from that infected person. And invariably, that is family members. Okay? So if you're living with somebody with COVID-19, you're automatically at high risk. And then the state health department will actually recommend those people, regardless if they have symptoms or not, that they should get tested as well with a nasal PCR test, one of those nasal swabs. And those can be done at, whether it be an Intermountain site, University of Utah site, Test Utah site, they can be done wherever, and asymptomatically, or whether or not they have symptoms. And then yes, by all means, they're counted in our case counts if they're found to be positive. And so if you've been exposed to somebody who's been infected and you have symptoms, those people are absolutely tested and counted in our case counts.
Yeah, that's important to know. I think there is sometimes a little bit of a confusion on what happens if you live with someone. I think at the beginning, people were thinking they wouldn't get tested because it was presumed that they had COVID-19, so the case counts were off, which made the mortality rate off. But it sounds like we are really testing people who come in contact. Are they required to get tested if they come in contact with someone who's positive, or is it a self-decision?
Yeah, they're certainly recommended from the state health department to get tested. And you're right, we have to reflect back on, what testing was like in early, late March, in that area where, we didn't have that many tests. We were able to test just a handful. We were sending all our tests to the CDC. We didn't have any local based tests. And so we were talking about testing just, a few each day. And then over the course of time, it was this incredible ramp up of testing capacity. And so now we have the ability to test well over 5,000 people per day. And that really came online in April. And so, yeah, initially we weren't testing asymptomatic people. We also weren't testing mildly symptomatic people because we were having to save our tests for people that were being hospitalized, that it really impacted care. And now that we've got, plenty of capacity in terms of testing, that's when the state has kind of loosened up to say, well, we really want to make sure we can do contact tracing effectively. And doing that really means testing these close contacts. And that's just a testament to our ability to test in the state of Utah.
That's good to hear that we've kept increasing testing capacity too. I think that's something that we were all a little bit nervous about in the beginning as well. Right. Another thing that I keep hearing about too is that when someone passes away, there's questioning whether we're testing them for COVID-19 if they weren't tested before, and if we're just assuming that they had COVID-19 and then putting them towards the death rate. Can you speak a little bit about what happens with that? Sure.
I mean, anybody who gets admitted to the hospital with respiratory symptoms is getting a test for COVID-19. And so if you're coming in with pneumonia, if anything that looks or smells anything like COVID-19, you're getting a test. If those patients, unfortunately, then succumb and pass away, regardless of the test result, we're not testing post-mortem individuals. There's really no indication for us to do that. And so, we test on admission when they come into the hospital or the emergency department if they've got a COVID-like illness. And then we use that test to obviously treat them. And that also really determines what types of isolation and personal protective equipment we use. But we then don't go and test anybody post-mortem. That really doesn't add any clinical value to anybody.
Okay, that's really important to know. I think that there's a lot of conflicting information about how that works from different states, not just here. Another thing too, so as the state opens back up, Texas just announced that they are opening back up sports stadiums to 25% capacity, which is the first state to do so. I don't know the exact timing on that, but sports teams, like high school sports teams, are going to start having games again. What are some ways to still stay safe at outdoor events? I know that there's a potential to be something this weekend in Utah. How do we stay safe at an event that there's going to be thousands of people at if we're going? So besides the fact that you shouldn't go, how do we keep staying safe?
Yeah, I mean, the first question you hit on the head is that's a very personal decision whether or not you decide to go. That is a risk question that you have to struggle with individually to say, what's the risk to me? And then what's the risk if I get infected that I pass it to somebody that's vulnerable, that's in my inner circle, family members, children, grandparents, those types of things. So that's your first and foremost. It's like, do you go? The second is, these are really high risk events. I mean, you're talking about bringing thousands of people together in a confined area with plenty of things to touch and plenty of things to be exposed to. And so, things that I would consider is definitely spacing at the event. Is 25% reduction in capacity enough to remain 6 feet apart while people are yelling and screaming at a sporting event? I don't know the answer to that, but I would think that it's probably not enough, especially if people are yelling at, the typical they would do at a sporting event. Another thing to think about is I would only go. Well, I personally wouldn't go, so we can't use that example. But if it's an outdoor venue, that's going to have less risk than an indoor venue. So, if you had to choose between a gymnasium and an outdoor football stadium, I'd go football stadium every time, just because you have more ambient air, more ways to diffuse the virus, and less concentration. And then, it's masking and really good hand hygiene. And so it would be going to the sporting event, trying to sit away from people as much as you can, wearing a mask, try not to touch different things, and also use appropriate hand hygiene. Those are the things that you could do to reduce risk if you chose to go to one of those events.
So you recommend wearing a mask at the event, even though it's still outside. You'd recommend that we keep those on?
Yeah, I mean, the way I think about it is that if I were to go to that event and I had SARS-CoV-2 virus in my nose, and I was yelling and I was screaming, having a mask would decrease the transmission of virus into the environment. And if you are in an environment with a number of people surrounding you and you're yelling and screaming, I would appreciate if the people that were around me were wearing masks.
Okay, that's good to know. Another thing that came out recently too is this Lancet study about hydroxychloroquine and the results of a study that they just released. We talked a little bit with this with Raj on Wednesday about clinical trials, but I'd love your point of view and kind of explaining it to people who are not scientists and don't understand every single thing that goes into it. Put it into simpler terms for us, what the study said.
Yeah, so this was a very large, what's called a registry study. And so people that get COVID-19, they get logged into a registry. And then there's investigators that use that registry to look at outcomes. And what they did was that they looked at people that got hydroxychloroquine for COVID-19 and compared to those that didn't. And what they found that there was no benefit to hydroxychloroquine, and that there actually may be a signal for worse outcomes. The challenge, though, with those studies, and the authors actually address this in the paper, is that there's really an indication for hydroxychloroquine the sicker you are. And so the more sick you are, the more likely you're going to get hydroxychloroquine. But also the more sick you are, the more likely you are to die, and the more likely you are to have negative consequences. And so unless you can really do a very close in-depth analysis where you control for severity of illness and comorbidities, that comparison is really, really hard to make. And so, and the authors really address this as well. And so really the only way to get a good sense of whether or not these types of drugs work, hydroxychloroquine or remdesivir or some of these other ones, is to do a randomized controlled trial. And that's what is happening all across the world. The UK has one of the largest, or the largest study ongoing on studying hydroxychloroquine. The WHO has a study ongoing. We have a study ongoing, all looking at these things. And these randomized controlled trials has defined stop periods where you stop. You have an independent group of people look at the data unblinded, so they can say, okay, this was the hydroxychloroquine group, this was the placebo group. And let's make sure that there's no signals for safety or efficacy. And so at those predefined stops, if this independent group says, whoa, wait a second, this hydroxychloroquine group looks like it has higher number of adverse events, higher deaths, they put a stop to the study. And that's the way these randomized controlled trials work. That's the way the ones here in Utah work. And so we have these predefined stops, and none of the randomized control studies have had to stop early because of a recommendation from these independent reviews. And so they felt comfortable moving forward with them. And that's where we are, and we have a planned stop coming up to make sure that our patients are safe.
And I think as more data comes out and more clinical trials kind of come out, we'll learn more every day about the best treatments for this. I know I asked Raj what he hoped to learn in the next year about which drugs work the best and how to treat this, and hopefully have a little bit closer to being to the vaccine. Which, speaking of, are we closer since last week? I know last week we were talking about the phase 1 trials that were happening with a couple of the vaccines out there with the small group of people. In the past week, has that moved on to phase 2 at all? Or are we still in that phase 1?
Yeah, so there's 6 or 7 different vaccine candidates that are in phase 1, phase 2 trials, and sometimes they combine phase 1 and phase 2 together. Those are ongoing. There's been a number of reports in the past week looking at preclinical studies, meaning in rhesus macaques or non-human primates that have been promising in terms of their results and development of neutralizing antibodies. Big announcement from AstraZeneca that they're partnering with the Oxford group that has made a vaccine that is going through and going into phase 1 trials that they hope to be able to develop lots and lots of manufacturing facilities. And so lots moving in that direction. We haven't seen any definitive phase 2 results yet from any vaccine makers. We anticipate that they'll probably be coming in the summer. And then likely phase 3 studies initiating fall, winter is our best guess. Okay,
that's good to know. The last thing I wanted to touch base on, someone actually asked us in our comments about plane travel. So as the summer keeps moving on, I know that people are starting to think about potentially going on a plane, whether it's for business or for work. What are some tips you have for how to stay safe before the plane ride, on the plane ride, and then what happens when you actually get to your destination? What should you do if you're visiting someone who's a little bit more high risk?
Yeah, so plane travel is definitely picking up, and we're seeing different things based on the different carrier. Southwest, for example, is not allowing anybody to sit in the middle seat. They're also requiring all their passengers to wear masks. And so we're seeing kind of variability there. Things to consider if you're going to be taking a plane travel. One is that if you are symptomatic at all, you do not get on that plane. That is not a place where we can have a symptomatic person. These planes are a very confined area with lots of people, an incredible place to transmit infections. And we've seen that in the past with tuberculosis and influenza, where plane travel can really be a nidus for infection. And so first thing, if you're symptomatic, absolutely not, do not get on a plane. The second is being really cognizant of hand hygiene in the airport and on the plane. Try not to be touching different inanimate objects, do lots of alcohol-based hand sanitizers, etc. And then clearly wearing a mask on the plane to prevent any kind of transmission that you may have into the environment. Those are the things that are within your control. The question you have is, what about who you're visiting? That really should be taken into consideration prior to getting on the plane and having a discussion with the people you're going to be visiting on the other end, even before you undertake travel. So if you want to go see your elderly 90-year-old mother who has, COPD, for example, you really should probably think twice about whether or not that trip is in your best interest or her best interest. Because there is a chance of infectivity while you get on that plane, go through the airport, get into your taxi, all those things, and then you go and visit your person. So if you have the ability to potentially quarantine or self-isolate before you visit somebody you flew to, I think that's a great idea. But you're now tacking on an additional 7, 10, 14 days to your trip. Okay, right. So, plane travel really needs to be thought of really closely and really think about your risk to yourself and to where you're going and who you're visiting. And I would really think about those things before booking travel or getting on flights.
Is road travel the same concept, or is that considered a little bit safer because your only touch points could potentially be like a gas station?
Right. So it's a fascinating question because when you think about your risk of infection, there's two things that you have to think about. You have to think about your exposure and then the time that you're exposed to it. So it's exposure times time is really your infection risk. And so in a plane travel, for example, let's say you're going across the country. You're going from, let's say, LA to New York City, a 5-hour plane ride. Your exposure period is, your exposure is pretty high, right? You're seeing a lot of people, you're in a closed area, but the time you're exposed is actually pretty low. It's 5, 6, 7 hours. Think about now a car ride across the country and you're talking 4 or 5 days. And so your exposure risk is lower because you're not in an enclosed environment. You can control the environment much more. You can do hand hygiene when you're going to the gas pumps and those things, but your time is much longer, right? So it's 4 days.
Okay.
And so you really have to factor both of those things in. And it really is, I think, dependent on the length of the flight and versus how long it would take you to drive. So shorter trips within 1 day, for example, in my mind, is less risk than a flight. But if you start talking about 3-4 days of driving versus 1 5-hour flight, those might get to be pretty equivalent. So in my mind, if it's less than a day's drive, that's probably less risk than flying. But if you start getting into multiple days driving versus 1 5-hour flight, then they might get to be pretty equivalent.
That's good to know. I definitely know that we have some things coming up that we'll have to think about what's best. Eddie, is there anything else that you wanted to mention today on what's been going on or any updates you'd like to mention before we jump off?
Yeah, I think, the state is opening up. We just had Memorial Day. People are wanting to get out and about, but we really have to keep in mind that our case counts are going up. So our risk today is actually greater than it was, back probably at the end of March. And so be safe. If you're going to get together with your friends, stay outside. Don't gather inside. Try to remain socially distant. Try to remain within 6 feet. Bring your own drinks and food, and try not to do a lot of sharing of utensils. We're seeing people that are getting really sick. We're seeing people in the hospital. I'm rounding on people every day that are dying from COVID-19. And it's real, it's out there, and we're seeing, more and more cases each day. So I would just emphasize, be safe, be careful. Now is not the time to let down your guard. You can still enjoy getting out, but we really have to do this carefully. Otherwise, we're going to keep seeing cases go up.
That makes sense. Well, Eddie, thank you so much again for joining us, and we'll see you again next Friday.
Okay, take care.
Thanks.
See ya.